Daddy, no, don't people are facing that one.
Orin is 12, loves riding his bike, loves Thomas the Tank Engine and has a very good sense of humour, but has lots of complicated illnesses that impact on his life. He is quite delayed, he functions around about 5 years old.
Orin, now you're really...
Unfortunately, Orin hasn't had a seizure-free day in 10 years. His epilepsy began when he was 3. We've had several different epilepsy diagnoses since then, and our last one was Lennox-Gastaut syndrome. We thought we would be able to get on top of the epilepsy with medication quite swiftly. That became fairly apparent within about 6 months that he was drug resistant and the different meds we were trying were failing. We basically ran out of options. Gene mutation meant that we had cardiac implications, so his risk of SUDEP became extremely high, and it became fairly apparent that we needed to do something fairly swiftly.
Okay.
This opportunity of DBS insertion came up and we ended up here. He understands that this is something that could reduce his seizures. That's Oren's motivating factor. I can do this if it means that I have less seizures.
Okay, Mama.
Yeah.
Okay, should I try the different sound? Yeah.
This study is designed to look at whether we can reduce seizures in a condition called Lennox-Gastaut syndrome, which is quite a complex type of epilepsy, by using a neurostimulator that delivers a train of pulses to the deep part of the brain. What we do is measure the seizures before we implant the device, and then after 6 months of the device being on and stimulating, we again record the number of seizures that the patient's having, and then by comparing the two, we can look at the effectiveness of the treatment. Most of the deep brain stimulators that are used at the moment sit in the chest and have wires that run up to the head, but with this device, one of the advantages is that it all sits in the head. That's particularly helpful for children because as they grow, the wires can stretch and cause problems. So by keeping everything up in the head, we hope that the complication rates will be reduced.
Surgery was tough because it was 7 hours. We were actually asked down to recovery before he'd even woke up, so we were there as soon as his eyes were open, which was really helpful. It's not been as awful as I thought it was going to be, our stay. It's actually gone a lot smoother, and I think that's purely been down to the professionals that have supported us all the way through. They've made sure that any hiccups have been smoothed over. We've managed to find a solution and we've navigated around it. And I think they've probably been the backbone of us actually getting through the last week, which has been tough, but it will be worth it, you know. Fingers crossed, switch on is in 5 weeks.
So these are x-rays of Oren's skull. This is a front-on x-ray, and this is an x-ray from the side. And what they show is the generator, which is this part here. So that's sitting in a window of bone, and it's screwed into the bone edges in these 4 places here. And then the wires connect to these leads, which are the ones which go deep into the brain, into the thalamus. And the stimulation happens at the end of the wires, where you can see there's a slightly wider bit, which is the electrodes.
They can't sit there.
I'm just trying to find a very good one.
Oh, don't worry.
No, we're doing anything awful. Like when we play your finger, we're just doing that.
You can only do this type of research if you have the right people involved, and for us that really means clinicians and engineers, and so we collaborate with a large number of people across many universities to make these things happen. It's really only by working together with a large team of people that you can make these kind of complicated trials work.
We went to the maximum. Is he finished having now?
No, he says he's fine for now.
1.6.
I told you I'd tell you.
Here we go. Right, we'll start this side. Are you going to
I was going to go this.
Pardon?
I was going to go this way.
You were going to go that way, were you?
Yeah.
You want to go that way? Well, go on then, you tell him to go that way. Steer him, kick him on, that's it. Bring him back this way though.
Oren's had the device on for 6 months. It's had a huge impact on his seizures. We know that his daytime seizures have reduced by 80%, but probably more impactful, he's not needed any resuscitation, which he used to need quite often by having generalised seizures, and he's not had any drop seizures, which are the ones where he can fall and injure himself. So that's had a huge impact on his quality of life. That means he can get to school and all that without the stress that it used to carry. To be able to deliver that for them, but also to do the research and the learning, which allows us to hopefully develop similar treatments for other children, is really, really satisfying. We're really pleased with the response that Orin's had, but he still is having some seizures and we'd like to see if we can do more. The next step for him is to try and personalise the stimulation so it responds to changes in his brain in real time, and we believe that could further improve the situation, and that will be the subject of the next study that we're doing.
We are still not alone. We're made to feel members of the entire team as much as the surgeons were and the nurses were and the engineers were. We were still very much part of that. We've dipped our toe in the water with this study. Going into the next phase will give us more opportunities to fine-tune it and hopefully reduce seizures even more. The reduction in seizures is definitely been brilliant, but the quality of life that's come with it is something that was just invaluable for Oran. He's turned 13, so I now have a teenager. He's definitely feeling his feet. He's happy to tell me no. He's developing his own opinions a bit more, and I think that adds to your quality of life when you can express yourself better. Having hope gives excitement and so makes the future look a bit brighter and a bit more obtainable than what it was. Now I feel slightly more secure. I feel slightly safer with the fact that he's having less seizures and excited that actually this could only get better.